I believe that sexual violence is an important issue that needs to be addressed because it is a platform and foundation issue for a slew of social problems.
We know that sexual violence is one of the most underreported crimes, and we know that the numbers that are available for New York City don't actually reflect the experiences of New Yorkers. So we can get numbers from the police department, we can get numbers from emergency rooms, but that's only people who report. And anecdotally, in our lives, we know plenty of people who've experienced sexual violence, experiences that fall in a wide range of sexually violent behaviors. And that's a problem. It's a public health problem that causes people to suffer.
Primary prevention is a very interesting concept because it's talking about considering how to stop something from happening. And it's not at the moment that something is going to happen. So it's easier to talk about it in terms of sexual violence. It wouldn't be primary prevention if a bystander stops a rape from occurring, as much as we would be very happy if something like that occurred. But primary prevention is looking at what is in the community that causes the social problem, in this case sexual violence, to occur, and how can we address those.
We know that that means changing social norms. It means changing the conditions that create victimization and create perpetration.
The Lower East Side Coalition of Project ENVISION is one of 3 coalitions in New York City that are community-based, who are working to end sexual violence in the community. And it's a partnership between the rape crisis programs that serve that area, Beth Israel Medical Center, in conjunction with the New York City Alliance Against Sexual Assault, and community members. And the idea is we really want it to be a project ultimately owned by the community, just with perhaps technical assistance from the rape crisis programs, but ultimately want this to be a project run by the community members themselves.
I came to be a part of Project ENVISION because I had been working in a rape crisis and domestic violence program in Brooklyn, and I was really interested in trying to get more experience with prevention work because I had done a couple of years worth of work with survivors and seeing how sexual violence really impacts people's lives. I really believe that through working with parents, we can change social norms. It's just going to be one strategy in working to kind of undo what we as a society think about sexual violence. But as I was saying, if you work with parents, it can be passed on to their children, it can be passed to other parents, and can kind of spread through a community. So I think, just one person learning about the issue of sexual violence and, about undoing some of the myths and misconceptions about it can really be spread. It can have a ripple effect through our Lower East Side community, through New York City, and outward.
And I want a larger cross-section of the community to consider this an important enough issue that, as unpleasant as it may be, that they want to do something about because they see it as a problem in their community. So that whole community mobilization around it is a huge piece. People need to talk about it more, but not just in sort of the titillating ways that when you see a specific incident that's reported in the paper, but really thinking about kind of like root causes and why things happen. But I don't think we have all the answers yet.
My hope is that this kind of a project and this kind of a focus could be taken up by other communities rather than having people sit quietly and just try and move on forward with their lives without acknowledging the damage that's been done to them or that's being done to them. So far as I see it, this is a way out. This is a way of addressing a problem that needs to be addressed.
Project ENVISION means a lot to me because working with people who's experienced sexual violence, it's kind of this never-ending tide. And this issue as a health issue and a social justice issue is very important to me. And ultimately, I'd love to see myself put out of a job, that sexual violence has ended and there's no more need for me to help survivors of violence because there are none. That would be a really great feeling.
If people want to get involved, they can email us to find out about events and our monthly coalition meetings.